So very pleased to be here. Personally feel very passionate about this whole area of work. I think as a society it speaks volumes about how we not only treat but I suppose uphold and enforce the rights and responsibilities of our elderly population. And I want to maybe just give you a sense of some of the thinking or work that the committee has been engaged in and are currently engaged in, and then give you my own thoughts in relation to potentially some of the issues and maybe even some of the solutions. So, yeah, we know we're living longer, and that's a good thing. And I've noticed in some of the conference literature, that's something to be celebrated. And that's quite right. And it says an awful lot about all that is good in terms of our health and social care system. We know the statistics. We know that 279,000 people over 65, 33,000 over 85, and over the next 20 years, that will increase to 456,000 and 79,000 respectively. We even know at this stage where that geography and location will be. We have the information that tells us where the increase in terms of our elderly population will be, down to the very constituencies, cities, towns, villages and wards. But the reality in relation to health, and my absolute baptism of fire over the last number of years as chair of the Health Committee, is that the gap in health inequalities is getting starker. The gap between those who have and those who haven't is increasing. And we know again where that exists, right down to the very constituencies. We know that it's in North Belfast, West Belfast, and my own city of Derry. And that's fact. So that would seem to suggest to me as a society that it's not going to be one size fits all, that we need to start targeting the interventions accordingly. Not paying lip service to it, but targeting where the objective need exists. And that, I make those points because that is directly linked to our elderly population. Because we have increased, if you like, prevalence of long-term conditions. And some of those conditions are actually predicted to increase by as much as 30% over the next decade and more. And we have clear challenges as a society in terms of, even here in the north, the numbers of people living with dementia. So therefore, our population, as it ages, is becoming more and more dependent on health and social care. That's not rocket science. So are we prepared? In short, no. And I say that for this reason. In terms of transforming your care, the policy direction, the shift left, the policy direction which I agree with, and I'll get on to some of the detail around it in a second. One of the pieces of work that we undertook as a committee was an inquiry into supported living. Because what we were being told was this whole focus on keeping people out of hospitals, looking after people at home, which I have to say, in my own view, is not always an option. But nonetheless, we started to dig down, we started to flush out, we started to try to understand, well, what's actually been done? And I have to say, it is quite shocking, but between the trusts and the department, there wasn't even an agreed definition of what supported living was. It was a mix of issues. So you say to yourself, how are we managing and preparing for a population, an elderly population, an ageing population that's increasing quite dramatically if we don't even have an agreed definition of what that supported living is? Currently, our committee are undertaking an inquiry into care. And I've just come from a committee meeting yesterday, and I'd make this point. There was formal guidance presented to the Minister for Health in November 2014 from the Older Persons Commissioner. That formal guidance actually reflected on issues of neglect in our system. Issues of minimum standards, which in my view shouldn't be our benchmark, but nonetheless minimum standards that were being breached. Now, this was not just an organisation, a sector or an individual saying, here's my blueprint, here's what I would like to see happening. This was formal guidance that was issued to the Department of Health, and the evidence went back quite a number of years, but it was presented in November 2014. The department and the RQA were in front of the committee yesterday, and only I'm too polite a dairy woman. There was nothing that has happened in terms of that guidance. Absolutely nothing. In fact, what was really, really concerning and alarming to me yesterday, when there's examples of care provision in some of our care facilities where whistleblowers as much as 64 times were alerting authorities, and authorities did not respond. I have to say, folks, it was quite alarming to hear that information yesterday. And only in December were the department then starting to look at the legislation and redoing the legislation and changing the fact that minimum standards shouldn't be our ambition. We should be asking for much, much more. I make reference to that because I would say to the organisation here and all of you that are in the room, feed into that inquiry. Feed into that inquiry. Let your views be known around the standards of care as it currently exists. And I watched the video, and I think Marge basically says it all in a very simple and clear, constructive way. There are clearly issues about how we access care as well. I'm dealing with, and I won't name the name, but I am dealing with a family in the Western Trust area whose mum is 91, who was assessed for care over 15 years ago, and in December, that care package was removed. Again, you would say, somebody who's assessed for care that many years ago, surely her care needs have been exacerbated, but her care needs now are not considered to be essential. Now, there's actually a judicial review taking place in relation to that particular case. But there is something radically wrong when we have a system that allows a person to be assessed and delivered care for a period of 15 years, 91 years of age, and it's removed. So that's what's flawed. What do we do? I think our system of health and social care needs absolute radical reform. And when I say that, I mean the structure of the system that we have. It's overly complex. It's overly bureaucratic. People do not have a sense of who is accountable in the system. We have a department and a minister, 6 trusts, a health board, local commissioning groups, a public health agency. And the system itself seems to compete with each other. And I'll give you this example. Residential care. We have a system where at departmental level and at ministerial level, whoever that minister would be, can say, I want to protect frontline services. And that's great. We all want to hear that. We want to see frontline services defined as well. But nonetheless, we hear that. Then that very same system allows the trusts to go in and remove or close residential care. And when you go in to challenge that in this system, you're told from the department and the minister of whatever persuasion, I can't stand over every single trust decision. Well, there's something radically wrong in the system if you can't do that. I do not see that in any other department. In every other department, the buck very clearly, whether you like it or not, stops with the minister and the department. Health, for the size of the population in the north of Ireland, is overly complex. It's overly bureaucratic, and there is a lack of accountability. There are very good, progressive, radical, outcome-based ideas that go into the system and nobody seems to know who's made the decision, or nobody seems to know why the decision wasn't made. So we need to actually radically reform that system, in my view. And I, to date, don't have a sense that the department are developing that blueprint. And unfortunately, whether it is our elderly population, whether it is dealing with waiting times, whether it is dealing with access to cancer drugs, etc., etc., etc. While that system is overly complex, we will continue to have those circular conversations. And I want to make reference, maybe just by way of closing, about a potential solution. I think we could do a lot worse than to look at what Scotland have done. I'm not saying it's perfect, but I think as a system, in terms of a model that has certainly moved back to, if you like, a traditional NHS-driven delivery of care. It has collapsed a lot of its boards and trusts. There seems to be more of a sense of accountability. There seems to be more of a sense of ownership of the process. So I do think that we could learn a lot of lessons from looking at our neighbours in Scotland and what they've done. One of the challenges, and I've heard it from the video clip earlier, how do we as a society move this room and all our rooms to being active participants in the process? And that's a challenge for all of us, not just consultees. We're consulted to death. How do we actually move to becoming active participants? And I do go back to my point that until we radically reform that system and that structure of how health and social care are currently delivered, then we will continue to be back at this point. So that's some of my thoughts. I would say to you a number of things. My door is open in relation to this particular issue, some of the challenges that hopefully will come from the conference today, some of the potential solutions. I would encourage people in this room to feed in to that care inquiry. And I'm hoping to stay for most of the day and to be part of the question and answer session. I want to wish you well. I want to use what resources, skills and door opening opportunities that I have to take these issues further. So I thank you for inviting me along today, and I wish you every success with the rest of the conference. Thank you.